Hello, everyone. I'm thrilled to be here today to help moderate the topic on mental health and issues that we're facing really as a nation. I want to share a little story with you. When I was driving down here this morning, I got a call from my son who's graduating from high school this year. And he said, "Mom, what are you doing?" He gets out a little bit earlier because he's a senior. He said, "What are you doing?" I said, "Oh, I'm driving down to Carson to help out with this mental health forum." And he paused for a second and he kind of laughs and said, "Are you sure you should be helping out with that?" I was like, and we started laughing. He was referring to something that actually happened last night. My husband is traveling right now for business, and I was at work, and I have three boys, and my youngest is 10 years old. Well, last night he decided that he was going to have life skills like his big brother and make mac and cheese. Well, he forgot he turned off he didn't turn off the oven, that was on the stove. He turned off the heat, but the gas was leaking out. And he was there for a couple hours, and when my older son came home, he realized it was an emergency situation. Needless to say, last night was really crazy. Everything is fine, but we averted a major catastrophe. But my point in telling you this long-winded story is everybody has things that come up, and everyone has stressors. And I don't think I could talk to one person if you asked, "Hey, how the last 4 or 5 years been?" I don't think one person I know would say, "Oh, so easy peasy. It was so no problems. I didn't have any issues." All of us have our challenges, and as a community, we have our challenges. And the issue of mental health, it doesn't just affect, us and our spouses and our children and our colleagues. It's everywhere. It is something that we all have to work to take care of our own mental health, but also take care of each other. And so I hope today, you being here today really chips away at that, because it's not an easy issue to deal with. I'd like to start, we don't have that much time today, but I'd love to start with learning more about the MOSE team, which stands for Mobile Outreach Safety Team. They are the resource in the Quad Counties when someone is having a mental health crisis. Carson City Sheriff Ken Furlong is here to introduce the team and to tell us more about it, and also to let us know how this is really helping the community here.
Great story. I have mine. I got to the table and I got my lunch and I sat down and ate, and I was sitting next to Becca and I, "What is this?" And she opened it up and I went, "Oh my God, I've always wanted one of these gifts. Whoever put them on the table, thank you so much." I'm not letting, this is not a speech, this is my picture. Nobody can have it. Thank you all for being here. I want to start you off on the good side. Get you going on that positive side. Carson City has a long time been out in front of predicting and anticipating the future and adjusting to those needs within our community from a public safety perspective. Long ago, we have Judge Lewis here in the back. Long ago, specialty courts were thriving here in Carson, realizing that the offense is not always what the story is about. And specialty courts can be used to work with the people that are having these major issues. And so from a public safety, fire, police, the district attorney's office, our court systems here in Carson City, we have long been on a pace to get in front of the challenges that we see. Those challenges started long ago, folks. 50, 60 years ago, when we saw mental health institutions or assist agencies beginning to disappear across our country. And across the country, what we witnessed was all of those caution flags coming up. Abuses of people who were in need instead of forced by law enforcement. People who were in need of assistance. Excessive force and mistreating of mentally challenged folks, which is skyrocketing. Here in Carson City, we realized that, Lord, greater than 10 years ago, much greater than 10 years ago, 15 years ago plus. The word de-escalation is probably one of the most important issues going on up here with these folks. De-escalating that crisis in our communities that is causing stress. And it happens to be that law enforcement very often gets involved. What do you want to drink?
You want you to hold that closer.
How about that? De-escalation across the country for law enforcement officials has become the drive. Unfortunately, it's not always there in every single jurisdiction. I can proudly tell you that it is in the state of Nevada with law enforcement agencies. We introduced all of our new recruits, our new officers to crisis intervention at the very beginning of their career in their post-training. Now, that's a brief introduction. Here at Carson City, this team is responsible for that ongoing, more in-depth training. We need to be able to recognize the signs and symptoms of what we are facing in order to de-escalate. Just because a person is screaming at you on the corner does not make him a violent person. And I have these most representatives up here that can talk about those challenges, those specific challenges that we face. What you see and what you hear is not always the fact. There are issues behind it. And I look through the exemplary training and experience of these teams. That is not unique to Carson. Reno has them as well. Douglas County has them as well. But the uniqueness is the understanding that our visions and our philosophies recognize the uniqueness of the jurisdiction or the community that we're talking about. Carson City is not always the same as Gordonville, or the same as Reno or Sparks. We recognize those unique challenges. Carson City is a rural community that often receives patients from outside of this community because of our resources. And yet the state of Nevada is very, very low on affordability and access to mental health providers, those people who are in most need. And so I'm very, very proud of these folks, and I'm going to introduce them one at a time. But first I want to begin with one of the biggest movements that we have going right now today. Again, we're talking about getting in front of the tsunami. Captain Craig Lowe is here. He manages our investigations division. And with him and a lot of other public safety and nonprofits and private people's contributions, Carson City is on the verge of opening up a child advocacy center here in Carson. Craig's going to talk to you just a little bit about that. Understanding that when it comes to mental health crisis, what happens to children at a very young age will continue the rest of their lives. So please welcome Captain Craig Lowe.
So yesterday the sheriff says to me, "Hey Craig, I need you to stop by tomorrow and just do a quick briefing, a little update on the CAC to a few people." And I walk in and there's cameras and a whole bunch of people. But as I look closer to the tables, I recognize most of you. So I'm happy to be here and to speak to you all about the Carson City Rural Child Advocacy Center project. For those of you that do not know what a CAC, a Child Advocacy Center is, it is first and foremost, it is not what we typically consider a family resource center. This is for a very specific segment of our population, a very unfortunate segment of our population. That is our children when they are victimized physically, sexually, and mentally. It is a starting point for what we hope will, at the most traumatic time in a child's life, it'll be a starting point where they can get better, they can heal. It is a point where we bring the child in and ask them to disclose to professionals the most horrific thing they've ever had done in their lives to them. It is a place where we use it as a gateway to the other wonderful resources within our community, but we are only as effective as that weakest point. So together, that collaboration, you get a starting point at this traumatic time. That's what a CAC does for a community. And every community should have its own CAC. We've been very fortunate to have a partnership with Washoe County District Attorney's Office, who has a CAC in their community. The problem we run into in our detective division is that a lot of our kids and families don't want to travel to Washoe County, so a lot of them miss their appointments. And that is a deficiency. It's too critical of a time in this child's life to not handle this properly. So in February of 2023, the sheriff and I sat down and we came up with a plan, an approach, because it's a monumental task to start a CAC in the community. It takes everybody at all levels. We came up with a plan. The sheriff gave me the go-ahead. We reached out to the mayor and to a lot of our leaders within the community. We sat down and kind of set a path. And I'm happy to tell you that as of today, courtesy of Dr. Jan Marson and Serving Our Communities Foundation, she has purchased us the Norcross House at 412 North Division for our CAC location. Construction is ongoing, but we actually have a location. The foundation has also pledged $250,000 in a match, and we've got some great partners at Toyota and some helping us with the ongoing effort. The fundraising is going to be continuous. We're going to really have to rely on our partnerships within the community. We've working with Carson, Tahoe, with our partners there, and to develop this center to make sure that it serves the children properly. So as of now, the construction is ongoing. The center will be located at 412 North Division, serving our communities. Dr. Jan Marson will be the executive director to start. We're very fortunate to be affiliated with them. We're hoping to receive a lot more attention and support as we push forward with this effort. Our soft date right now is July to open it. It'll feature 2 interview environments where the detectives will meet with the families and the child forensic interviewers who are specialists in these types of interviewing to collect the interview in a forensically sound manner so it can't be disregarded in court or challenged. I don't have enough time to thank everybody that has helped us to this point. It's been a marathon. It's been a race to get it done. The sheriff asked me just to step in real quick to give you all an update. I've got a pamphlet here that's got a QR code on it with all kinds of information pertaining to serving our communities. You just look at the website, you'll find my phone number. If you have any questions, give me a call. We can talk about it. But with that, Sheriff,
Thank you.
over to
Thank you, Greg. Notice I didn't leave my map on the table. They will swipe. They do this stuff to me. Now let's talk about our mobile outreach philosophies. It began with crisis intervention, and it has grown tremendously here in Carson, and we anticipate that growth to continue. In fact, I meet with the state resources, state agencies on a pretty regular basis lately. Where are we going and why are we going in that direction when it comes to mobile outreach and crisis in your communities? For the sake of the hospital here, and for the sake of some of my divisions, the sheriff has one goal, and that's that mental health, people that are facing a mental health crisis do not belong in our emergency rooms, and they do not belong in our jails. I can tell you, and these folks that are about to speak are going to tell you, that's a challenge in and of itself. It is a very large challenge because very often, as we have seen over this last 60 years, is a growing reliance on law enforcement to intervene when there is a problem. And if that intervention does not have the training and the expertise and the understanding of what they see and what they hear, then that raises the probability of injury, either by physical or by mental means, committed by law enforcement. When do we get involved? When it's at the crisis level. When do we hope to be involved? Below that crisis level, where we can maintain some semblance of a hopeful life, that there are future plans and dreams and hopes and aspirations, and a reduction of the fears and the anxieties that goes along with every single day. Shelby, I love you to death, but when you watch the news, it's tough. It's tough to keep an optimistic view on the world today. Imagine living with a mental health condition. Imagine living where the family's ties have loosened up to the point where they're not there anymore. And that when intervention comes in, it has to be the police. I have up here three of my four. We hope to be able to expand it as we go, but we are working with the state. Ms. Becca Bach is, I'm going to call it the queen of the cake. And the reason I call it that is this. She represents what we all do on a daily basis, working together on the problem. Becca is actually a state employee that is health, behavioral health.
Division of Public and Behavioral
Health. She is on a joint agreement with the Carson City Sheriff's Office, which is not unique, by the way. But she is a state employee that is working with us on a daily basis, working on crisis circumstances. Sitting next to her is Deputy Gibson. It was really fun assigning Deputy Gibson to the unit because his identical twin brother preceded him. And so we just kind of switched them out, nobody knew anything different. Both he and his brother have been phenomenal assets to the unit. And then we have Deputy Leola down at the end. His partner, Miss Becca, or Miss Brittany, just got married about a week ago, so she's still on that partly honeymoon type of thing, which is another reason why, we need adequate resources. Because you have to anticipate that these people are not going to always be available for everything. And so in that line, what we do is, this is the formation of the group that many of you in this room may have already attended, crisis intervention training throughout Carson City. We maintain that we must have a minimum of 85% of our sworn staff trained and certified on crisis intervention. These are the instructors and the coordinators of that project. Okay? As of this year, we didn't even have open spots for law enforcement because we're well above that minimum standard. That we're out training in the community, businesses, service organizations, Carson Tahoe Hospital folks, on how to intervene, looking for opportunities amidst the crisis of mental health in our country. And so with that, Ms. Becca Bach is going to speak to you about some of the challenges that we face, and they are immense. The challenges are keep these issues out of our jails, keep them out of our emergency room, and do what we can to provide for a better life. Ms. Becca Bach.
Hello, I'm Becca Bach. I'm a licensed clinical social worker, and I've been with the State Division of Public and Behavioral Health for 27 years now. And I've been with the Carson City Sheriff's Office on loan with the Mobile Outreach Safety Team since 2014. So we're rolling into our 10th year. And the program has changed dramatically. We started as a pilot program where I rode once with the deputy once a week. And then we graduated into 3 days a week with 7 different deputies. And then in 2016, we got a grant for a behavioral health peace officer, which was a big step in the movement of the program because that allowed a specific partner 40 hours a week. So we can just hone in on mental health calls, which are pretty much every call that we get, behavioral health component. So that was the biggest movement was the behavioral health peace officer, which Israel and Michael both are behavioral health peace officers. So it's Brittany and I as the licensed clinical social workers. Once we rolled out as a team, I was with Don, Michael's twin brother. Going 40 hours a week, we realized we were only getting to 47% of our referrals. And that's pretty not okay. So that's when the sheriff went to the board of supervisors and asked for a second team. And I think we're doing much better, but the acuity of the clientele that we're serving is skyrocketing. And so we're just jumping calls and we still have all these referrals from deputies. So we're trying to keep up. We're kind of scrambling to keep up because the issue is growing. So I'm gonna let my partner talk.
So again, I'm Deputy Mike Gibson. I've been employed with the Sheriff's Office almost 12 years. January will mark 12 years. Been on the mobile safety team for approximately 2, and I do see a lot of people that I do recognize. And yes, my twin brother Don was before me with Becca for about 6 years. So it's been a pleasure. And law enforcement is kind of unique in the fact that this assignment, we don't take people to jail. One of the main goals that we do is jail diversion. So let's say, for instance, deputies go out with somebody, maybe they pay a larceny in Walmart, and we respond to that. It's one of our clients that we've been dealing with. We can get on scene, and maybe if there's a mental health component to it at that time, maybe we can divert that person from getting sedation and or going to jail. So we'll take that person from that location, maybe to the hospital, the Mallory to check them in, depending on what stage of crisis or the level of psychosis that they're in at that time. But again, like the sheriff said, we don't want people with mental illness being tied in jail. If we're not available and we're unable to get to that location during that specific call, then we do work with the DA's office on some of our clients. We have relations with them where we can notify them and say, hey, this is who we're working with. That ticket they got, or that citation they got, or the arrest they got, we want to see if there's any way we can divert some of that. And they work with us to divert a lot of that. Real quick, Shelby, you just let your son know that you did pass our assessment, so you're okay to come home tonight. And that way, you doesn't give you any slack. So, the other thing the sheriff spoke about was the CIT intervention training. We do 2 academies a year. And I think Israel can contest during our academy, because we're tenured. We were taught hurry on the calls for service. So every time you finish the call, you got to go off to the next one. So the patrol deputy's time was very valuable, because the sergeant saying, go to the next one, you after it, going to go to the next one. With these teams that are developed now, it's very important to know that the sheriff, we're not micromanaged per se, but we can go to a call, and if we need to be there for 6, 7, 8 hours to solve that crisis, we're allotted that time to do that. We don't have sergeants or captains or the sheriff or anybody calling us and saying, hey, you need to hurry up, the next call's pending, right? So we're available to be able to handle that crisis. And when we speak of crisis, it's not defined by us or you guys or anybody in general, right? The crisis is defined by the person experiencing that crisis. So in the academies, like I was going to go back to, they teach us to speed, go, hurry. Well, in the CIT academies, we're teaching the deputies and social workers in those environments to slow things down. Because you really can't get to what's happening unless you slow it down to really listen to that person, right? Communication's paramount. So in those trainings, it's amazing when you get some of the cops in there and you just see the light switch flip back to the academy. They're like, oh my God, that's not what they taught me in the academies. But this class has really opened my eyes to a better way of communicating with people with mental health related issues, right? So, it's pretty good. I don't know if you want to add something to it.
Okay. That's some challenges.
My name is Deputy Israel Ayola, and I've been with the Sheriff's Office for about 12 years now. I've been with the crisis team going on 3 years. My partner, her name is Brittany Bowman. She's a clinician. She's not here today. She's in a different training. But yeah, I think the most has been very successful. I can tell you, when I first started my career in law enforcement, I didn't really believe in the whole mental health, I never really dealt with it. So I just, take them to jail and be done with it. And fast forward to now, realizing all the training that I received and some of the cases that I dealt with. And I can tell you mental health, it's something huge. And like they mentioned earlier, the problem is getting bigger and bigger and bigger. They were the first team. When I came on, I thought having 2 teams, we're going to be able to catch up on a lot of the referrals, a lot of the calls. And I can tell you, we can't keep up. We get referrals we've gotten from the governor, FBI. I mean, we get them literally from everywhere. We're actually the cops call when they need help. Because sometimes they get stuck on these very critical calls that they don't even know how to deal with it. So then they'll call us. Because sometimes some of these calls, is there a mental health component? Yes. Is there a criminal component? Yes. Which direction do we go that could be better, more beneficial for the individual? So a lot of times we get involved and try to navigate, hey, what's going to be more beneficial for this individual? Because a lot of times the jails are not designed to be dealing with people with mental health. The deputies are not trained for that aspect either. The jails are not designed, we don't have the equipment that's required to be able to treat somebody in the jail. So we got to be able to navigate that part of it. And like he was saying, sometimes a crisis, it can be, I can tell we've had some cases that are very, very difficult. And there's been some incidents that we could be there 8-10 hours, sometimes even a whole week. Luckily, we have a lot of players in the community that are able to help us. We'll be like, hey, we have this individual, this is the kind of case we have. Can you help us? Can you help us to, for example, Mallory, hey, can you keep this person for overnight till we figure out something tomorrow? Then the following morning, back to the drawing board. What are we going to do with this person? We've had cases where people end up stuck here in Carson City. They're from out east, and we've been able, thankfully, to the community again, we've been able to get them in plane tickets. We've been able to get them in buses, and we've been able to get them back to connect with their families. One of the major calls that we get all the time is the misuse of 911. People just want to talk to somebody. They're mentally ill. They don't recognize that calling 911 is a crime. But every time they're calling 911, they're having to send a deputy out. And that's taking a deputy from a criminal call to go and meet with this individual. So a lot of times we see it where these people unfortunately end up going to jail for the misuse of 911. So again, that's where we try to get involved. And we have clientele that we've been working with them maybe up to a year. We just kind of hover over them, make sure that they kind of stay in line. They don't, because we don't want them to go back to jail. And like the sheriff was saying, we don't have a lot of resources either where, hey, we're going to have this individual go over here now, and now we don't have to hover over them. Sometimes, unfortunately, we got to kind of stay on top of him. And sometimes, unfortunately, they do go to jail, not by us, usually patrol deputies. But like I said, overall, we try to kind of navigate with the community. Like I said, the community has been great. If it wasn't for the community, a lot of things we do, we wouldn't be able to do it. So.
So the sheriff wanted us to speak to our challenges. So one of the challenges, obviously, we've talked about is the sheer volume of calls that we get. We get over 1,000 calls on our cell phones a year. Those are 1,000 calls that are not going to our dispatch. So we have those, and then we have what we call calls for service. So that could be a person who's homicidal or suicidal or in crisis. So we're going to jump as many of those calls as we can because we're helping patrol move on to their other calls that there are. So other deputies are usually super stoked to see us because they're like, oh, you're here, bye. And that goes with paramedics as well. It happened yesterday. They see us, they're like, oh, you got it, bye. So that works out by helping other people get onto the other calls that are out there. But we're only Monday through Friday, so crisis doesn't happen on the weekend, right? So that's a challenge because we don't have a team out on the weekend, but we do have 95% of patrol trained in crisis intervention team training. And why that's important is our deputies are highly skilled, so they have been taught how to recognize what if there's a behavioral health issue. So they first recognize that and they know how to use the system as far as, does this person have a crisis at the level of a hold, and do they need to go to Mallory, or is it subacute where we can use our CCBHC, our certified community mental health system. So highly skilled deputies, until we can get more teams, that's what we have. So that's how we're overcoming a barrier. And I can tell Michael wants to talk.
Well, I just want to speak to the adolescent side, right? So I was a school resource officer for a school semester as well, and sometimes when the behaviors come into the school, we're like, man, poor Johnny keeps coming in every day with behavioral health issues. So another thing that we kind of tasked ourselves with is how can we help the schools out from a community approach, right? So we created a system where the school resource officers assigned to the schools now will liaison back over to us with any troubled youths that are experiencing behaviors in school, because the school will wrap them, the educational side wraps them through the school environment, but then when they go home back in the community, what's happening, and they're back in that same environment, right? So the next day they go back into school and it's the same thing over again. And I would witness that, and we have to do something about that. So now we have a program that's going to put in place where we do liaison with SROs. They'll give us that information on both Johnny or Sally, and then we'll make contact from a community standpoint with those parents and just kind of find out where's that behavior coming from and try and offer those resources to them to get that behavior corrected with the hopes of making the school environment a little bit more controlled for everybody that's going to school. Another thing I think we'll maybe back up just a little bit so we know when Becca first came to us, as she spoke to, she was with different deputies at different times. She would respond to traffic accidents, petty theft crimes, batteries, domestics with a deputy. And at times she would never get out of the car because she wasn't required to do that, right? But now that we have the full-time teams, 2 full-time teams, and I'd say about 75% able to stay up with the referrals that we're getting. And the referrals come from the patrol division detectives, they come from the community, they come, like as he said, the FBI, the governor's office, so we get it from everybody, everywhere. So if you guys have people and folks out there that you're concerned about, we did leave some business cards on table 12. You can grab those, it has our contact information on there. Send us an email, call us, and then we'll see how we can help navigate, your guys' concerns with whoever you guys are working with. And I think that's good for now.
I want to get, is it on? Oh, how about now? I want to get to any questions that the audience may have. But I do want to acknowledge one of the biggest challenges that we do face in the Reno, Sparks, Carson City regional area. And that's that these jurisdictions often have the only resources for most of northern Nevada. And I mean that, most of northern Nevada. We have those resources, so very often people are coming into this region, getting help. It's a challenge getting them back to their homes. So with that, we'd love to answer any questions from the audience.
I have a question. Can I ask a question on the moderator? Does that get me right?
Yeah.
Okay. As you described, the most team and really the goal is to keep these individuals out of the emergency room, out of our jails. Obviously, anyone listening here can see this makes sense, right? So, but we also talked about, the need is really growing and you guys are limited. Are there any efforts in place to try to expand what we kind of, I think, know seems to work well?
Were you listening to my meetings earlier this week? In working with our local government, because understand that there's not a money tree out there, okay? But in working with our local governments and working with our state partners, we are looking at what is it that we are doing today. We've asked Ms. Becca to spearhead a project. What are other jurisdictions doing across the country so that we can compare and contrast? Always looking for opportunities, as well as expanding our team into a third team. That is challenging because we have faced this onslaught up front by assigning people or reassigning people versus adding on new. So we take some of our resources, such as our patrol division, it comes down in the amount of people assigned in order to facilitate this. So we have met as a couple of times over the last couple of weeks with our state partners. We need to, as we called it, comb the process. Let's look at in this year what it is we're doing, what is the volume we're doing, how are we doing it, are there other model programs that we need to adopt little pieces of, and obviously bringing on more staff down the road to address those issues, and how can we bring them on by in an efficient means that doesn't shackle local governments with the costs.
Sure, a quick follow-up to that. Will we, if we're working towards that, in the meantime, here in the room today, you have business owners, you have community members who care about this community, who want to be involved. What advice do you have if they are just wanting to kind of learn more or to be helpful with this? Is there any way they can kind of get a little bit of training? That because people sometimes these things happen in businesses, they happen in different venues, sort of.
Yeah, so I think it goes for everybody now. It's if you guys ever want to let ride along, we're available. So that's, obviously we've got to find a comfortable car to put you in. So we don't want to put you in the back plastic seat to go on ride along with us, but we are available to the community. So if you guys want to go on ride along, reach out to us. You guys fill out a quick application, the sheriff gets it approved, and then you guys go on a day's shift with us, and we can discuss things and things you can look for with your loved ones, things of that nature, that may help you in your personal lives. But we are available to you guys for that.
And also we have 2 CIT academies a year, and it used to be when we first started we had all law enforcement, but now it's half and half. So we have half law enforcement and half community members. So that's something, our next one, it's usually November 40 hours and April 40 hours. So in that training, you're standing alongside law enforcement and learning how to recognize behavioral health issues and de-escalation skills. There's role plays, and it's packed with information, and we go around the community and look at all the resources so people can become more familiar on how to direct people that may come to a business.
Okay. We've got just a couple more minutes. Is there anyone out in the audience who'd like to ask a question of the sheriff or anyone on Mo's team? Anybody?
We can't leave until somebody asks the question.
I have another question.
That was a bad.
Okay, where do we go?
Yes, ma'am.
I work with children in foster care and could really use, a team like you to respond, like one of my kiddos in particular. But he is very freaked out by police officers because they are also the people that took him away from his mom when he was 2 years old. Do you have the ability to respond not in uniform?
So I would suggest, one thing we work on with these teams is co-responding models, social worker, police officer, deputy, is to she helps destigmatize this uniform, right? So, and that's part of our goal in our few local communities to destigmatize this. And it does help. We do have a lot of people that are concerned when I show up on scene. Maybe Becca makes the first contact with that subject, but we can establish rapport pretty quickly with most people that we come in contact with. And so I would suggest reaching out to us so we can make contact with you, and then we can get through that barrier.
And that's kind of exposure therapy, right? Because he sees that a deputy could be helpful and not harming, then maybe next time he looks at a deputy, they can look at, oh, this person's here to help me.
Those challenges in our society. Sorry, I'm a little bit louder here. The stigma of mental health. Okay, the stigma of law enforcement only coming to arrest people. Those are things that we are trying to overcome. That's why these officers are in uniform. I want this community, I want the children in this community to realize that officer has the tools and the resources to help versus harm. But we're working, as I said up front, we're trying to change an attitude that's 60, 70 years old. That's an entire generation of us. And that's a challenge. But we can accommodate for that lower level of without uniforms and overbearing law enforcement presence.
All right, well, thank you so much for the presentation and for answering our questions. Thank you for that technical support. Well, we've just heard how critical the MOS team is, and we're so lucky to have them in our community because it really seems to be a way to deal with these situations that makes a lot of sense. However, also looking at the bigger picture, we want to be able to prevent those crisis level situations from happening in the first place. And Carson Tahoe Health, they do have an ER that does take people who are having critical issues of mental health, but they also have a wide range of programs and support systems in place to try to make it so we don't get to that point where the MOS team is needed, but we can prevent that, and they can support not only our adults but also our young people in the community. So it's my pleasure to introduce Michelle Joy. She's the CEO of Carson Tahoe Health, and Katie McKay, Administrator for Community and Patient Experience. They have a presentation about some of the current programs available through the Mallory Behavioral Crisis Center and the hospital, and how the need has really grown to bring in more mental health support services for our youth. So I welcome you, and I'll give you the floor.
Thank you, Shelby.
Okay, so the sheriff came up here and I thought, oh, he's holding a speech. And then it turns out he's holding a map. And so this actually is my speech, but after listening to the sheriff and the MOS team, I don't know that I need to actually follow along on everything that I had written, but I do want to start by saying we need to give a huge round of applause to our MOS team because we are so fortunate from a community perspective to have that resource.
Yep.
So
That's
and part of that is the partnership that law enforcement has with the hospital, that is also, from my perspective, after being in multiple different communities and different states, you don't always see that. And so we are very fortunate to have that partnership, the support. Everything that you heard from the MOST team is really trying to work in conjunction with them. I don't want to belabor the point around keeping folks out of the ER and keeping them out of our jails. So when you think about the emergency room, it's set up to take care of those medical emergencies. Someone that's having a heart attack, somebody that's having a stroke. It's bright lights, it's a lot of commotion, a lot of chaos. It can be really loud in there at times. It is not a healing environment for somebody that's dealing with a mental health crisis. And so over the years, forever and ever, it was the jail and the ER were the two options that we had. You heard the MOST team make reference to Mallory. Who knows what Mallory Behavioral Health Center is? Okay, probably about half the room that looked like raised their hands. My goal this afternoon is that if I were to ask the question at the end of this presentation, everybody would be able to raise their hand and know what resources we have available and what Mallory provides to the community. So this chart, again, Mallory opened about 7 years ago. So this graph, the blue lines on here, shows in 2016 by month how many hours we were holding or boarding mental health patients in the emergency room. Again, not the ideal situation, not a healing environment for them. Sometimes they'd be in there for days waiting to be able to seek treatment somewhere else. So what that meant was that for those in the community that had true medical emergencies, we weren't getting them in a timely way in the ER. I'm sure some of you have experienced those long wait times to be able to get in the ER. If we have a bed tied up because of a mental health patient, somebody with a medical emergency is not getting in. And so that's where we decided that we had to find a different solution. And that became a Mallory Behavioral Crisis Center. So that opened in the end of 2016. So when you look at the orange bars on this graph, that shows you the reduction in the hours that we were having to hold people in the ER for mental health crisis. Huge difference. I think it also made a difference for our law enforcement because they didn't have to bring those folks to the ER and they could take them directly to Mallory. So not only were we helping those that were in crisis, we were also helping the overall community. So what is Mallory? What does it actually do? So it's different than an ER. It's staffed with behavioral health trained providers, therapists, social workers, the entire team. Oftentimes, your emergency room physician and your ER staff, they're trained in crisis intervention and de-escalation, but they're not necessarily trained on how to take care of that mental health patient and what are those needs. And then being able to have the time to find the resources that are needed. Again, just like law enforcement, the ER is rapid, quick. We want to get those people in, treated, and out the door. When you're in a mental health crisis, it may take days to be able to stabilize. And so now we were able to create an environment where they could stay and receive the stabilization and then spend the time finding the resources that they needed once they left Mallory. So we see roughly 1,500 patient visits a year within Mallory. 65% of those end up being true inpatient admissions into our behavioral health unit. And then the interesting part is that actually less than 5% of the patients visit Mallory more than once or twice a year. I think oftentimes people think that it's the same people coming in for services within Mallory, but it's not, because once they come through Mallory, we're able to then connect them with the resources that they need from a community perspective. And then the last part of that, just like the sheriff talked about, from a hospital perspective as well as a Mallory perspective, we're a resource for Northern Nevada. So we see folks outside of Carson City. 75% of our patients come from Carson City, Douglas County, and Lyon County. That mirrors exactly our service area for the hospital. So the hospital serves those communities, so does Mallory. So I want to share a story. I have a couple stories to share about the impact and the folks that we've cared for in Mallory. We had a patient, 20 years old, who came to Mallory on his own for treatment with opioid addiction. He had a long history of addiction. Before he came to Mallory, he had a full-time job, had a home to live in, and a supportive family. But due to the progression of his addiction, his life fell apart. He showed up to work under the influence, came home at odd hours of the night, was stealing and lying. The patient was then kicked out of his home, fired from work, and was left without supportive family members. When he came to Mallory, we were able to assist him to apply for McKay. We were successful in getting him insurance, which allowed him then to receive the treatment that he needed in order to live a sober life. Throughout his stay, the patient kept expressing how truly thankful he felt. He was often tearful when describing how lost he had been feeling with no family, no job, and no home. He described how his time at Mallory helped him feel safe, supported, and helped in a way that provided a path forward to treatment and sobriety. He feels that without Mallory, he would not have been able to receive the help he needed, and he would have ended up living on the streets. Huge impact that we're able to make every single day from a community perspective. And so one piece that I want to emphasize with this is whether that patient is discharged from Mallory or discharged from the hospital, we're required to ensure a safe discharge plan. So that involves our physicians, our nurses, our social workers, our case managers, the patient and the family, working to figure out where's the best place that they can go and where are they going to get the most support that they need. Sheriff Furlong also mentioned one of the challenges of folks coming in from outside of the area, and then how do they get back to where they came from. So a couple specific examples that actually come from the first quarter of this year is we had a homeless patient who moves around between Gardnerville, Minden, and Carson City. He presented to Mallory on his own. At the time of discharge, our case management team assisted the patient in applying for residential programs. He was accepted at Vitality and Gospel Mission in Reno. We also picked up all his medications from CVS and obtained a donated glucometer for him. We arranged a residential bed for him at Gospel Mission per his choice, and then we provided the transportation for him to get to Reno. The other one was a homeless patient from Winnemucca. So under care in Winnemucca, in a crisis situation, they don't have something similar to Mallory. His therapist sent him to us here in Carson City because they don't have the resources in Winnemucca. But he does get services through Humboldt General Hospital and has a job actually at Maverick. So we went back to Winnemucca where he can continue to access those outpatient services. So as part of that discharge plan, we provided him transportation to get back to Winnemucca. So we're trying to do whatever we can to make sure that folks are going where they are going to get the most support and where they want to go when they get discharged. It would be great if every community had the resources that we do here in Carson to provide these services. Our most team, Mallory, the hospital, all of our community partners. You just heard about the added resource that we're having with the Child Advocacy Center. That's huge for this community. Being on the healthcare side, we know that when you can provide that care locally, it's better for our family, for our friends, for our neighbors. Having to travel to receive care creates huge burdens. It adds to that mental health crisis when you have to travel and leave your support system. But there's still more work for us to do. You heard from the most team, increasing needs from a community perspective. So we recently completed our triennial community health needs assessment. We do it from a Quad County perspective. It's multi-agency when we do this work. And what we heard again in this last health needs assessment was that mental health services remain a top priority, especially for our children and teens. There's a need for more providers, outpatient services, crisis care, and community education. There are still a lot of stereotypes and stigma around the mental health population that from a community perspective, we all have opportunities to learn. And our kids are struggling. You heard it brought up by the most team. As one Carson City community member shared, we've had kids in inpatient in the acute care hospital, which again is not the appropriate setting for them, for months just waiting for a psych bed. It wasn't safe to send them home, and there wasn't anywhere to send them locally. We had to send them all across the country just to find a psych bed. Our kids are in need of healing, and so to shed some more light on this, I'm delighted to turn this over to McKay.
She's way taller than me. Hi, everybody. You know, one of the things I hope you're hearing throughout this, and in case you didn't hear it, we live in a community of innovators. So what the most team described, a lot of communities don't have that. That is people looking at people in a holistic fashion and working at what's best for the person, not the easy button. Because locking someone up who's acting out is the easy button, but it's not the right button. The other thing you heard Sheriff Furlong say is they didn't wait to get funded to put 2 officers out there. They took 2 officers that already were paid for to do other things because this was an urgent need. That's happening in your community. That's innovation, and it's willing to do what you have with what you have because we have to do it. And that's something that Carson Tahoe did. When Michelle showed you the slide about the Mallory Behavioral Health Crisis Center, we were one of the first in the nation to do that. Little Carson City, Nevada. And guess what? We didn't have the funding to do it. We went to our public. We went to a private foundation, Mallory, and said, we have got to do this. We still aren't getting properly reimbursed, but we have to. It's critical for our community. So I'm going to tell you a few things that are going to feel really heavy, but I want you to hear those heavy things with the confidence in your belly that together, as community, we are going to make a difference in this area too. Okay, does everybody promise? Raise your hand. Tell me you're going to promise. Because this is heavy stuff. It is, because it's heavy because it's about our kids. So, we've talked about crisis. I heard the word onslaught. You know, we, through COVID, we're like, wow, things are getting worse, and they have been. But I have even got to tell you, and you folks could corroborate, even since January, you cannot believe the onslaught, okay? So when we're talking about, we used to have to, prior to the Mallory Behavioral Health Crisis Center, our psych holds were in the emergency department. Well, we don't have a kids crisis center. We don't have kids inpatient facility, and in fact, the state of Nevada has been fined by the Department of Justice because we don't have outpatient care for our kids. But we're going to. Because guess where the kids are now? We have 8 pediatric beds in our hospital, and on any given day, most of them are filled with cycles of kids, 8-year-olds, 10-year-olds, 12-year-olds, 15-year-olds, 16-year-olds. Cycles. But guess what? They're also not being held in our emergency department. We don't have the facilities, but we are going to have the facilities. And we have a plan. But I don't know, happened upon these figures, and it really, you just need to know. When we talk about these folks who are in crisis, or this 20-year-old who was addicted to opioids, those are not other people. This is us. These are my family, your family, our neighbors. These are our straight-A students. These are our rock star football stars. These are all of us. So every 2 years, the state of Nevada does a Nevada Youth Risk Behavior Survey. In 2021, we're talking about Carson City High School kids. 1 in 5 reported self-harm. That's cutting, burning, right? 1 in 4 had created a suicide plan. Now, mind you, this doesn't mean all the high school kids in Carson City. This is of the kids who responded to the survey, but this is devastating news. 1 in 10 reported attempting suicide. 66% said they did not get the kind of help they needed when feeling empty, anxious, sad, or hopeless. Okay, so now we know how bad it is, right? And it's so bad that it's like you almost throw up your hands. But we're not willing to do that. Most team is not willing to do it. They're getting onslaught, they're getting more support. We're doing the same. And we have this crazy plan that we know can work because of the community where we live. And the people here that are willing to do what we need to do to heal our kids. And that's a really important word, because a lot of people treat the kids, and a lot of people have services for kids. But if we don't heal our kids, we're just giving it a Band-Aid. And so we call our vision, we call it a crusade. Because a crusade means everybody rising together to do what needs to be done. Dun, 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 dun. So it turns out that to really heal our kids absolutely need clinical services. Our kids need therapy. Our kids need, there's so many different things that are provided within a clinical setting at all different realms of the spectrum of what somebody may be struggling with their mental health. But the other thing we know deeply that we will be addressing concurrently is that foundationally, all of us, even in this room, we've lost connection. And our kids are at a level of lost connection like we've never seen before. They don't have connection to themselves. They don't have connection to one another. The environment, healthy foods. A lot of that may be this, right? But this isn't going away. And what we know, isolation, I don't know if any of you have seen this data, it comes out, but loneliness increases the risk of premature death by 26%. It is more dangerous to our health than smoking 7 or 15 cigarettes a day. Let that sink in. So what that means is, like, we have to take the concept of mental health out of just this mental health. This is whole health, right? And whole health means the whole being. Exactly what our MOST team is doing. They're seeing things from a holistic perspective. And that's what we have to do. So we believe that if we look at things from a holistic perspective, we can actually create a cultural transformation. Because some of the struggles kids are having is because they've never been taught resilience. Sometimes, many of us even too, think that if I feel bad, I'm bad. What's wrong with me? Everybody else is happy. We need to do things like teach ourselves how to be comfortable with who we are as humans. We need to teach kids how to connect to one another and have resources and tools that if you share with me, as most kids who have attempted suicide, we know when they're not successful, they will tell us. They attempted to tell a friend. The friend didn't know what to say. They don't tell their parents, teachers, counselors, coaches. We've got to train our kids, and we've got to train ourselves. But what we also have to do is look at it and kind of rebuild ourselves from the ground up. Like how we used to be connected as people. And like plug the circuit in again to feeling alive. Being aware of what it means to be a human. Embracing life, feeling important. You know, I bet almost any kid you ask, they don't trust their own voice. And as you trust yourself less and less, you just keep shrinking, right? We need to uplift the energy, so we call it alive. And the work that we're doing is all based on this idea of believing that we can transform our culture, our community. We can do this. So we look at it in an integrated way, and it has 3 components to it. Again, our fabulous MOST folks, you hear the word destigmatize. Michelle says destigmatize. If we can have the conversation be so comfortable, like this is all part of who we are. Everybody's hurting. It's okay. It's okay to feel human. And we destigmatize, all of a sudden we have access to resources that we never had before. And we empower, we give tools. And there's just a plethora of programming that goes along with that. The other thing is that healthcare, working from a very old model, has everybody come to us. If you need care, you come to us. And you'll still need to do that, and that's great and all. But a lot of people, one of their number 1 barriers is transportation. And if you've got a 16-year-old who desperately needs clinical therapy, and you have 3 kids and you're a full-time working parent, how are you going to get them to therapy, right? So it's critical that we go to where the people are. So that's a very important component of it. And then the last thing is we're pulling together a healing hub for these clinical resources so that therapy can take place where it needs to, group therapies and art therapies and all like that. But pulling these things all together is where the power is. Because it's so much of what we're doing right now, we have a patchwork of services that don't really integrate. So this is a whole lot of boxes, but basically what this shows you is our 4-year plan of how we roll out the programming to destigmatize and empower and one of our first steps is, okay, how do we unite with other partners and go to areas where they already are? Boys and Girls Club. And the Boys and Girls Club, even from their early learning centers, age 5, they need these services and programming as well. So we start there. Community-based mobile therapy. We're also getting an RV and a live bus. So imagine if the Alive bus pulls up to a high school or a junior high. The worst thing it could do is, oh, you're going to be a freak if you go to the Alive bus, right? You know, we have to make something that's cool and achievable. So what if instead we barbecue hamburgers and there's puppies? Everybody wants to go to a live bus now, right? So that's the way we're framing this conversation. We're trying to find out what are the real barriers to care and go behind that and create a new way of looking at it. And then the last thing is the Healing Hub on campus. When we pulled together this plan in January, we were predicting that we would do a kids crisis center probably in year 3, because there's so much to do just to really establish the critical outpatient therapy that we need immediately. We don't have that luxury anymore. 8 kids on our PEDS floor, 4 more kids in our emergency department. If your kid has an appendicitis, sorry, go to Reno. It's exactly where we were when we opened Mallory. So we've pivoted very, very quickly, and we are working to basically immediately set up inpatient care and a crisis center for our kids, retrofit some of the facilities we already have within our hospital so we can get this open and start healing the kids. I mean, these kids that need inpatient care, 8-year-old, well, you have to go to Missouri. We can't sleep at night with that. We cannot sleep at night. None of us should be able to. And then we'll be building a new building. So, as Kenny said, money doesn't fall from the sky, but I really believe, just like with the Child Advocacy Center, when you're on the right path and doing the right things because we have to, it will be supported. And we are working tirelessly to make that happen. So then we'll have this integrated healing hub, and I really want to stress the difference here is the word healing, woven into every piece of it. And the work where kids and adults are getting the care together. Because you can't just work with the kids, right? And that the community, we work together. And each of us is part of the solution. And together we know we can give our kids the life they deserve. And here's how I know we can do it here. Carson, Tahoe this year, we're celebrating our 75th anniversary. Woo woo! Hello. But you know how we started 75 years ago? Did you know that prior to 1949, if you were trying to have a baby, you'd have to drive through Washoe Valley on those old roads and go all the way to Reno? Do you know how many babies were born on the side of that road? If you had a heart attack, you had to go to Reno. So the community pulled together and said, we need to build a hospital. And we did. And this is one of those moments, and it's a moment we feel so proud to live in a community like we do, because like the Most team, like Mallory, we do what we need for one another. And so those really, really staggering numbers I talked about in the beginning, please don't focus on those. Focus on what we know together we will be able to do for our kids. So thank you.
love for you to talk a little bit about two the psychiatrists that are recently added to kind of the team.
Let's see. Hello. No. Why is it green? 3. Yes, so thanks for asking that, Shelby. I probably shouldn't call them unicorns, but it is very, very rare in any healthcare setting to have 2 fabulous child psychiatrists leading the charge in all of this. It's harder and harder in many places to find healthcare providers that are focused in a similar way and have a lot of innovative expertise, and they are helping us pull all of this together. And interestingly, through they're like pillars, right? And so then they're also helping us attract incredible talent to be able to carry this off.
Right. And a lot of people aren't necessarily aware of how critical, psychiatrists obviously can prescribe medication. Psychologists do more, behavioral therapy. But sometimes with these critical mental health issues, even with children, that medical piece can be a really important one with everything else. Again, not looking at something as like, okay, you're sad, take this pill, okay? But it's like it's a big. That's what I'm looking for. It takes a lot of different tools.
Yes.
And have those psychiatrists here can sometimes be an important piece for healing and for getting kids out of tough situations.
Absolutely, and a lot of times it's just establishing the balance, and then you can build upon that. And so exactly to have that level of expertise.
Does anyone have any questions here for our panelists? Right back there.
I just want to point out, as a family physician, a great deal of the mental health goes on in primary care offices. And Las Vegas established a psychiatric program called Pediatric Access Line, and that's being run by the psychiatrists, child psychiatrists, to help primary care providers take care of those kids and those people in their offices. You don't necessarily go on to see a psychiatrist. I assume if you've recruited some very innovative psychiatrists, that they'll be involved in that program and going about.
Absolutely. It's one of the things that we've been talking about with our physicians and all of our providers that we have within the clinics and within our behavioral health services. The largest challenge for us is having enough staff and making sure that we're not burning out the 2 child psychiatrists that we already have. And so we're continuing to recruit and have that support staff. One of our child psychiatrists actually, she is one of 4 individuals that created a national hotline for physician suicide. So she's had experience on building the crisis call line. The one that she worked on is very specific for physicians, and they just received their not-for-profit status, but we're tapping into her to continue to identify what we can do here in Northern Nevada.
Any questions? Anything else you want to talk about as far as kind of where we're moving, how quickly we want to move forward? I know we had a lot of boxes up there.
Yes.
I was trying to read everything. But realistically, I think whenever you have a big issue and you want to move in the right directions, it's just starting to take little bites out of it and heading. It has to be, a slow process, but just it gives us hope when you think, okay, we're just going to start chipping away at this. And it seems like, or it appears to me, this is kind of how you look at that as far as, okay, this is ideally, we'd love to have this, $65 million building that can do all this, but we know that's not realistic. But just taking those simple steps to start chipping away at that.
Yes, although we are primed and ready to retrofit our current clinic space and our hospital space within our current facilities, we could transition to be serving kids immediately if we can get the funding. So that literally, if we had it by May 1st, we'd be open by March. And that's definitely something we're eagerly working on. So that's our big bang. The other things, as the funding comes and as the programming and the recruiting develops, then we roll that out. But yeah, so the bigger plan is definitely in stages and waves. But as described from January until now, what's been happening with these legal holds, we're desperate to open the crisis for the kids and then the inpatient care.
And I think what's important to think about is that, I have 3 children of my own. I have a range of an 18-year-old all the way down to a 10-year-old. And sometimes I think about, gosh, what is, because we know mental health has been declining for a while. And you touched on the fact that, at a time when, kids have phones and all these social media, it's supposed to make them feel so connected, but it actually, in a lot of ways, has done the absolute opposite in making them feel less connected and not having a lot of real relationships, more kind of ones online and through social media and their image on there and what people think about them. And also, when they've been growing up, think about all the kind of instability that they've had between COVID. She's, as he was referred to, turn on the news, like on every level of whether it's what's happening in our world, what's happening in our smaller communities, what's happening with our health, with COVID. There's been so much instability, and they feel our instability.
Right.
They feel like when we have anxiety, when we're nervous about finances, or gosh, what's going on with inflation, they feel all of that. So I feel like, what I'm trying to say is, these kids have a lot to deal with now that we didn't have to deal with. We kind of developed and formed without a lot of this. So I just think that it's important to think about that.
Well, and I think the point you're saying is really crucial. And part of why the programming we'll have is also for parents. Because when we were growing up, it was so different. And so you can't necessarily even see in your kids what they're experiencing. And we really can't relate to it. And you can't just say, it'll be fine. You're so smart, so that's some of the awareness and the tools we have to provide for people. And we have to, so many parents in a really earnest, well-meaning way, actually drive them further into their shell. Because they don't know, I don't know how to deal with it. It's so different than anything that I've experienced before. So really helping the parents understand is a critical component to it.
And I think as a general community, and even I find this in work at times, we do stories even that deal with these big hard issues, mental health and the declines that we've seen. And it's easy to get a little overwhelmed, like, this is just too big, we just can't do this. But I always, when we're putting together a story, I'm wondering, well, how many kids are really going to see this, or how many parents are really going to see this piece I did on fentanyl or whatever. And I think how I try to look at it is like, it's okay if I spend hours putting this together, and guess what? This one kid saw this, or guess what? This one parent said, hey, I've got to have a conversation about this, and it saved, So I think when all of us as community members at those, I know everyone in here cares about the community and our kids and everyone's well-being. So I feel like if you can just feel that you are doing something, even if it's just one person it affects, or if it doesn't have to be huge, because that's where things start. And it starts with kind of these little acts and and I think you always feel better, like there's hope when you can take little bites.
Absolutely.
And I think that's one piece. Kitty touched on it about how fortunate we are to be in the community that we're in, and I think part of that is given the size of Carson City. And it's manageable to be able to pilot these programs and see how is that going to work and what is that impact, and then be able to scale from there. If we were in a community like Fallon, it's not large enough to actually be able to long-term, ongoing support some of the services that we're able to do here. And I think that we're the perfect size to build these new models of care and take it out to our community.
Where do you recommend that parents start if they sense that their child needs help or needs support services? Where do they start? I know a lot of it, like you said, falls on pediatricians, but what do you recommend?
I think it's reaching out to our clinics, to our behavioral health folks, everybody within the school district, the counselors also know. There's a lot of support within the schools when it comes to mental health. We actually, from a Carson Tahoe perspective, partner with the schools and go into the schools when there is a crisis situation and respond, whether it's the teacher, the counselor, whoever it is, can call, and we will have a team respond to the school within, I think, 45 minutes to be able to help in those situations. And so I think it's either through the school, the Boys and Girls Club knows how to get a hold of us. It's tapping into those resources.
Now, these ladies are a wealth of information. I can answer or ask all the questions. Is there anyone out there? Okay, right there.
Hi, this is actually, I think, both question and comment. So I really appreciate what was said about whole health and getting beyond treatments and services and really looking at the healing and how that ties into whole health. When you were talking about how some of these kiddos at the moment, we don't have services here, and they have to go elsewhere, I see that as a break in the link of whole health because you are in essence taking out family.
Absolutely.
Or taking out peers, or taking out friends.
Yep.
And so this is really more of, thank you for bringing that up because that is a true aha moment in terms of completing the circle. We talk a lot about wraparound services, and I know that, in Carson, we're working at, the survive, stabilize, thrive, but how do we get there? And that's that whole health aspect. So I just wanted to say thank you for speaking to that.
Well, thank you, but I think what you just described in terms of whole health, and then if you heard from the parents what it would mean for their child to be sent out of state, it's beyond all reckoning. And for kids, there's all these different levels of what people are feeling and what sort of support they might need and how you can stabilize here, all that sort of thing. But I just totally lost my train of thought.
Well, and I think about in law enforcement and juvenile probation and how with addiction issues and when juveniles have been sent to treatment facilities and they do so well. And then
They come back. Yep.
And because their peers in the community or the neighborhood, we can't suddenly create new friends. We can't suddenly create new support systems. And so putting that emphasis on not just the healing of the person, but the healing of the peer group.
It's exactly correct what you're saying, and it's so wonderful that you understand that too. And when we talk about, we've talked a lot about crisis, and the reason we've talked so much about crisis is because it's a crisis. But the key is we're talking about crisis stabilization only whereby we can then get people into healing therapy, right? And so even one of the methods is called it's intensive outpatient. So the kids go to school all day, and then for 3 hours after school, they meet with a group of other kids, and it's usually, I think, is it like a 6-week program or something, and they learn skills, they learn connection, they learn how to be able to be back in their life, because that's what we want, is for people to be normally alive, right? So, and it's actually so achievable, but it's just a lift to get there.
And I think one of the other pieces of that, you know, Kitty had put up all those boxes and here's our 4-year plan. And we were really committed to, okay, we have to build those wraparound services and figure out what those are in the community. What are those outpatient services? Because if we can prevent that crisis from happening, that's where we want to be, is there so that we don't have to do the crisis stabilization center and have those inpatient beds. And, you know, the reason that it's become such a imperative and we focused on that crisis piece is because we have so many kids right now in crisis that we have to figure out how to take care of them and then build those outpatient services at the same time.
Thank you.
We good?
Well, I'd like to thank both of you so much.